Are we ready? Okay. Good evening to all of you, and thank you for coming. We are here again, gathered at the quadrangle in Banjul to give you an update by the ministry, and this is normally done by the Honorable Minister of Health, Honorable Ahmed Lamin Samate, but today is going to be read on his behalf by Dr. Bitey, who is the Acting Director of Health Services. So we will now allow Dr. Bitey to come and read the statement on behalf of the Honorable Minister, and then followed by the question and answer session, and then from there we can disperse. So thank you for coming once again, and then we're also sorry for the delay, but we do hope that we'll adjust the time, and then we will definitely work according to schedule. As you know, sometimes we have some technical issues here and there, but those issues will be addressed along the way. So on that note, I now invite Dr. Mustafa Bitey to come and give the statement on behalf of the Honorable Minister of Health, Honorable Ahmed Lamin Samate. Dr. Bitey.
Good evening, ladies and gentlemen. The Ministry of Health would like to update the public on the situation of our national response to the COVID-19 pandemic in collaboration with partners through the National Health Emergency Committee and the various subcommittees. The 18th National Situation Report, since confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th of March 2020, revealed the following. One, the Gambia records no new laboratory confirmed COVID-19 case. As we speak, all 38 laboratory test results received from the Medical Research Council lab were negative for COVID-19. That makes it a total of 175 tests have been done so far. There is one inconclusive one awaiting confirmation. 6 new people have been taken into quarantine, and this makes the total to be 38 now. Since the beginning of the pandemic, the country reported a total of 4 confirmed cases, 2 of whom have recovered, 1 passed away, and 1 undergoing treatment. And currently, as I said, there is 1 probable case. It is important to note that all 4 confirmed cases were imported. The global picture, since 31st December 2019 and as of 6th April 2020, at 23 hours 49 minutes, a total of 1,343,367 cases of COVID-19 have been reported from 206 countries or territories. Of these, 74,613 deaths were registered, which gives a crude case fatality rate of 5.5%. The African region, as of 6th April 2020, has 46 countries reported 4,827 confirmed cases of COVID-19. Senegal, our nearest neighbor, has reported 226 cases now. The first set of cases in the affected African countries were all imported. However, now local transmission is on the rise. We hope the public and ourselves will continue to be vigilant and to call our toll-free number 1025 for advice and for sharing of information. Finally, I would like to take this great opportunity on behalf of the government of the Gambia to thank the people of this country for solidarity demonstrated during this period. I would also commend all health workers, communication practitioners, and the security personnel for the hard work and sacrifice you are doing for the people of this country. I wish to thank all the partners, government departments, the private sector, municipal area councils, as well as communities for the support and collaboration in our efforts against COVID-19. Together, we can make a difference. I thank you very much for your kind attention.
Thank you very much, Dr. Bite. Thank you, Director, for that assuring statement. As usual, if you have any questions, you may ask 2 or 3 questions, and we can discuss for the day. And your media organization, please.
And I have those 2 questions. One is on the those at the border, because I read one story, I think recently in Korea, and then at Angala they complaining that even the house and the office they use is not up to date. They're using the house that was built for the border. So I don't know when the ministry will upgrade those places. That is one. And secondly, the issue of the relief package. Earlier, Kering Mode, I think Kering Mode said in one of the committees that currently there are discussions to see whether they will help those that are less privileged for people simply have the extension of the state of public emergency. So I don't know how far with those discussions and what do you expect to see with regards to those. So those are the 2 questions.
I can tell you that it's part of the plans to upgrade the point of entries. And we've visited that place in Amdalai. Like you said, there were some issues with electricity and all. And I think GRA were kind enough to connect them. But the plans include upgrading the point of entries. And this has already been included in some of the things the World Bank is funded. About the restoration and to help the socially disadvantaged, I know I was privy to be in a meeting where Minister of Finance is working hard on that to ensure that if these things are done, if these measures are taken, there will be safety nets for those type of people. The government is looking into that, and budgets have been made, what it will take. The demographic studies have been done. They already have the statistics of people who will need those type of support and what it will require. So there's plan to help them.
I believe the director can elaborate, because we are just coming from a risk assessment. They say about the border entry points, And just as Dr. Bite hinted, and then they are being upgraded, but at least first-hand experience, latest information of what you've seen over the weekend.
I think basically what has been said, that is exactly what is happening. That's the plan, is to, where we don't have points of entry, official points of entry, the plan is to have those areas to have official points of entry. Where we have is just to look at them, review, and refurbish where necessary, and then also try to ensure that all the materials that are required are also provided. That is also in the plan. But currently also what is happening in Amdalai is that the team is working very hard with the team in Senegal. They're doing what we call cross-border initiative. And in this cross-border initiative, what they are doing, they're going into communities, because this is our health authorities, and the health authorities of Senegal and the Gambia are working together to reach out to all the communities within the borderline, so that they also sensitize them, engage them, and also for them to take action, and to ensure that they also limit the movement of people within these 2 countries. So this is something that is also ongoing, and we want to thank the 2 countries for coming up with an initiative, a cross-border initiative, so that this has also been extended to other regions in the country. So basically the plan is to review the existing structures, and then to make sure that what needs to be done are provided. And if you look at recently, with the support of the IOM and as well as the ministry itself, we're able to provide some basic materials for those points of entry across the country. So this is something that you will see when you go. You will be able to see thermometers, you will see computers, you will see materials, PPEs, and any other equipment that they will require to protect themselves, and also whilst they are doing their work. You will see this thing by yourself, and you'll see the buildings are also of good standard. So what we need to do now, areas without official point of entry, the plan is to have those facilities built in those points of entry. So that's the plan for now. Thank you.
Dr. Bite and the director said, and we are working on it, and what we've seen in the borders, at the official points of entry, we have isolation centers, And the challenge is not the official boarding center. The challenge we've seen is the unofficial boarding center entry points. As we know, Gambia borders are porous, which means that we have to appeal to the community to be vigilant and help us. We've been to Sabi, for example. They have identify 8 unofficial entry routes, so people can still carry people in motorbikes. And we have to understand that as long as Senegal continues to register cases, Gambia, we are not free. And that's very important, you know. So, and this is a collective effort. And I would like to thank Dr. Vite and the director for that elaborate response. And if you have any additional questions, you may ask. Anyone? As you say, it's very important for us to work together. And I would like to thank WhatsApp. The platform is taking action because there's a lot of global misinformation, you know, especially on this pandemic, not just in Gambia. So I would like to thank, you know, the managers and owners of WhatsApp for working on that. I would like to thank you, and I would like to thank the community. And there's one case, for example, today. The United States has sent an aeroplane to dispatch its citizens and permanent residents. But there was an audio going around that people should not go to the airport because that plane is bringing medicine. So if you're an American citizen or an American resident permit holder, you believe in that fake news, you would have missed the flight. So you stay here. So it's important to take your time and follow official information. We thank you for the partnership. See you all tomorrow.